Hello and welcome back. I'm Nurse Alyssa, and today we're going to be talking about Endoform natural and antimicrobial dermal templates. But first, if you could smash that subscribe button, it would be greatly appreciated. So let's get started. So Endoform is made from sheep, so ovine, and it's a extracellular matrix composed of 85% collagen and 15% just important secondary molecules such as structural and adhesive proteins. It does come in two different forms, which is either natural, which does not have any antimicrobial properties to it, so you wouldn't use that on a wound that is infected. And then it also comes with an antimicrobial form. So that's what you would use if you do have either a local or more deep infection. But as you'll see later on, if you have a deeper infection, you want to make sure that it is being treated first before you start this. So it does stimulate blood vessel formation. It supports wounds that are in the inflammatory phase. Out of that phase, there's little half moon slits that allow for drainage to pass through easily. And it can be used on any phase of the healing process to stabilize, correct, build, and reorganize tissue. So the Endoform Antimicrobial, it does have 0.3% ionic silver, and that's to inhibit any colonization, prevents biofilm, and it is non-cytotoxic. So we're going to use the Endoform for wounds that are either stalled partially or full thickness with less than 40% necrotic tissue. So if it has any more than 40% necrotic tissue in the wound, we got to get rid of that first before we can use the Endoform. We can use it over bones and tendons, and it can also be used with compression therapy, negative pressure wound therapy, hydrobaric oxygen therapy, and in total contact casting. Precautions with the Endoform. So once you've used it for 2 weeks and you don't no longer have any signs of infection in the wound, you want to move over to the natural Endoform. With any wound, it is always better to use just the natural instead of using something with an antimicrobial, because we want to make sure that those antimicrobials are going to work when we need them. So after using the Endoform Antimicrobial and there's no signs, we're going to change to the natural. Avoid using with any reconstituted collagens, and Endoform Antimicrobial may cause some discoloration to the wound bed and the peri-wound. Just to keep in mind, it is perfectly normal. So we're not going to use the Endoform on untreated infections, acute inflammation, excessive exudate, active bleeds, third-degree burns. If we have an over 40% necrotic tissue on a wound, we're not going to use it. Or if a patient is sensitive to ovine, which is sheep, or ionic silver, we're not going to use it in these cases. So to use the Endoform, first we're going to make sure that the wound's nice and clean. We've irrigated it with normal saline and we have dried the peri-wound. Next, we're going to put a layer of Endoform. So you can see over here that I have this little drawing here. So we're going to put the Endoform right into the wound base, and we're going to put it in dry. So we're not going to add any liquid to it at this point. So we add the Endoform onto the wound, and then we're going to moisten it to make sure it gets in all the crevices. Okay, so just lightly moisten it. And then if we do have a very, very dry wound, we can use a hydrogel over the Endoform. Okay, so we would use just a thin layer, use your cotton tip applicator instead of the normal saline on top of the Endoform. Okay, so either we're adding just normal saline to let it get in there, or we're putting hydrogel, and I mean that's for your bone dry wounds that we want to add a little bit of moisture to. Next, we're going to put a layer of adaptic down. And then we are going to put our cover dressing. So if we are using a hydrogel, we want to make sure we're using a cover dressing that isn't just going to absorb and suck everything right through, because we want to keep some moisture in that wound. So we're not going to use something that is has an extremely high absorption rate. So yeah, so we have our wound, our endoform, our moisture, our adaptic, and our cover dressing, and you just secure that. So daily care of the wound, the secondary dressing, like the cover dressing, it can be changed as much as you need to, as much exudate as is coming out, that can be changed. We're going to actually leave the underdressing, so the Endoform, we're going to leave that in place for 3 to 7 days. And we're not going to remove any of the residual endoform. We're going to leave it there. So then when we're actually changing the endoform, if there is like no endoform there, we're just going to gently irrigate and apply twice the amount of endoform, up to a maximum of 4 layers. So we want to make sure that there is a little bit of residual when we're doing the dressing change. So we want a little bit to still be there. So if there is just a moderate amount, you're going to gently irrigate and apply the same amount of endoform. If you have a lot and like pretty much all the endoform still there, you can cut back a layer if you have multiple layers. Or you can extend the wear time. If you're doing around the 3, it can go up to 7 days. So the expected outcome of using the Endoform is that there is measurable improvement within 3 weeks. That's all I have for this video. I will catch you in my next one.